And so my grandfather was ordained a knight, so his wife was a lady. Now, when my mom named this organization Lady Adaure, I didn't know that was, my grandmother died before I was born. I knew her as Cordelia. That was a name I've always known. But Adaure is her Nigerian name. So my mom wanted to tie that in. So Lady Adaure Outreach Foundation, named after her mom.
Beautiful.
Yeah.
Beautiful. Okay. So what can you tell us a little bit about the work that you all do? And also, since your mom is the one that kind of started, what inspired her to do that?
So the organization was co-founded by us in 2013. At this time, my mom was wrapping up her PhD in public health, and she's a registered nurse. She's all about patient care, healthcare. That was her thing. I was still in undergrad, pursuing my degree in journalism. Didn't know what public health was, but I loved the mission behind it. So when my mom is doing her dissertation, her project is in Central America, and the research she was doing was on people who are doing grassroots health initiatives in Central America. And so as she's doing the research, little things are creating larger impacts. And so she felt inspired, was like, well, if people that look like me in different countries can do this within their communities, why can't I? Because as we're all Africans here, we know that the healthcare system in Africa or developing areas is fragile. Yeah. It's fragile here, so let alone there. And so she got inspired by that. And so she named the organization in her mom's name, because her mom died in 92, right before I was born, at the age of like 59. And that's obviously relatively young from just what we would consider preventable issues. So it was complications of diabetes and other things that she had. And so a lot of things that we see in our community, whether we're here, there, wherever, is, just a little bit of things that we can change, little lifestyle behaviors that we can change to live, hopefully, a long life. And so that was the inspiration behind the organization. And so what we would do was, we're always going to Nigeria anyway to visit family. We said, okay, well, let's also have an impact. And at this time, it was very small. Just even if we could just print out some flyers, put in the newspapers about like public health awareness and how to keep yourself safe, drink a little bit more water, walk a little bit more, lessen, how much fried foods you're eating, just little things. And so that was our first health fair. It was just a little small like booth, if you will, outside of my grandfather's home in the village, the rural side of Nigeria, giving out like supplements. I think we went to Sam's Club before we left here, got like some bottles of, Tylenol, things that, we take for granted. Everyone has a leave in their cupboard and things that folks there might not have. And just, thanks for coming. Here's a little baggie. Here's what you can do to help yourself. We don't even know if it had an impact. But then people started getting used to it. They were like, wow, that was helpful. Thank you for sharing that information. When are y'all going to do it again? Yeah. And we're like, okay, again. So at this point, my mom was like, all right, well, just one time. Okay, right. So we got back. We got back, and my mom wasn't a citizen at this time. She just had her green card. So she's like, you know what? I want to start doing this a little bit more global. But to do that, I need, some protection. So let me get my citizenship. So she did that. She started like looking into how to make this a little bit more official. And it's a little bit challenging to have an organization that's servicing outside of the U.S. as a nonprofit here, right? You can't get the benefits of a nonprofit if you're not serving people here. So we realized, okay, well, this has to be an NGO based abroad. So that's the official part of it. But then what next? So we got a little bit more structured with the process. And so now we're going into our second year, and it became like an actual event where we actually announced that this is happening, not just like a walk-up situation. And it was still very, very, very small. But as the years went on, the organization just continued to grow. People expected this. So we said, okay, well, the first weekend of every year, that's going to be the weekend. So that's in stone. It's going to have an agenda, and it's going to be an all-day event. And it got to the point where there were just so many people coming. I mean, the healthcare professionals that we were contracting, they can only do but so many hours. It wasn't possible. So we said, okay, well, one day is not enough. Let's do 2 days. So then it blossomed into a 2-day event. And we kept doing that for years and years and years and years. And then we realized, well, 2 days, it does have impact. But if you're an NGO and you're servicing this community, what else from February through December before you get back in January? So we started publishing public health communications. And at this time, I was working at the CDC. So I'd been doing it there, doing all types of articles and writing blogs and such. And I'm like, well, if I'm doing it here, why can't I do it there? And so I was writing similar content and just like prevention, care, blase, blase. And you also have to recognize that this population, they're not receiving information like how we are. They don't have smartphones. Most of them don't. They're not on the internet like we are. So you have to tailor your communications to meet them where they are. And so they best receive information in the church or at school, right? That's where they spend most of their time. And they don't have 9 to 5s in the village, right? They're at church or they're at school. So that was a challenge. So we had to build these relationships with local media, which are the newspapers, bulletins, education bulletins, and publish that. And so that's what it was. That's what our organization was, public health education, and then this 2-day fair. And we kept doing that until 2020.